All right, I have 9 a.m. on Tuesday. It is Tuesday, April 21st, just to let you know about that. Sometimes I need to be reminded of what day and what time it is as well, because every day seems like Groundhog Day. So welcome to our second series in our Telemedicine Echo. Thank you for attending. The Heartland Telehealth Resource Center and Missouri Telehealth Network have partnered to bring you these telemedicine echoes, and we'll address topics including operations, clinical, legal, regulatory, evaluations, and technology. So we'll try to cover the gamut during these echoes, and we appreciate your attendance. I'm Janine Gracie, Project Director for the HTRC, and I have the privilege to moderate these sessions. And I also want to make sure that we continue to shout out to our healthcare providers that are joining us this morning, that are on the front lines, and we appreciate everything that you are doing and know that it is a busy time for all healthcare providers, and want you to know that we're behind you and we're supporting you. Before we get started though, I'd like to ask everyone on this echo to rename your echo screen name. Show your first and your last name and your state. And if you do that, you can, then we'll know, what states we're talking to today. And also the way you do this is you right click on your picture and then it will say rename. So then click on that and you can easily rename your picture. That's great. Thank you so much. All right, so now we're going to have the hub team members introduce themselves. Kristen, I don't think Kristen can join us on Tuesday, so she's not here. But Evelyn, would you introduce yourself?
Good morning, I'm Evelyn Nelson. I'm a psychologist and also the lead for the Heartland Telehealth Resource Center.
Thank you, Evelyn. Rachel.
Hi everybody, Rachel Mutra from the Missouri Telehealth Network, Show Me Echo program and the Heartland Telehealth Resource Center.
Thank you, Rachel. Robert.
Hi, I'm Robert Stiles with the KU School of Medicine, Department of Pediatrics, and also with the Heartland Telehealth Resource Center.
Great, thank you. Tim.
Good morning, Tim Davis, Oklahoma State University in Tulsa, a telehealth manager and the Oklahoma representative for HTRC.
Thanks, Tim. Heather?
Good morning, everyone. My name is Heather Hagan. I'm a telehealth analyst at OSU CHS.
Wonderful. And last but not least, our speaker, our didactic for today, Karen.
Hi, Karen Edison here. I'm with the Missouri Telehealth Network and our Show Me Echo program.
Thank you. We'll hear more from Karen here in just a little bit. Let's see here. Since we have several of us on the Echo today, usually at this time we introduce our Echo participants, and there's just so many of us that we're not going to get through that. And if we did that, we would take up all our time. So what I would like for you to do is just type your name, organization, your title, and your state into the chat box, please, and that way we can know who all is on the Echo today. So thank you for doing that. All right, let's see if there are, sometimes we have some phone participants, and I like to make sure that we are able to introduce those folks. Anyone joining us by phone today? I'm not seeing that. Okay, good deal. We're all on Zoom today. Wonderful. All right, a few announcements before we get started. For a more collegial environment, we will use our first names only. I don't think we have this problem on this Echo, but we just want to be conscious of not using confidential or protected information. So let's be conscious of that. Raise your hand if you desire to speak and ask a question so that we can answer those. And before you speak, just please say your name. And then keep yourself on mute if you're not speaking as well. That just helps with the sound of the echo. So thank you very much for that. The presentation will be available on Box, as mentioned before. And we would certainly like for you to bring any kind of cases forward. So please volunteer a case, even if it's you're having trouble with implementation or evaluation, those types of things. Please give us a case that we can discuss so that everybody can learn from each other. And our team will put those case recommendations in Box for everyone to access once those are submitted. So thank you. All right, I'd like to introduce to you Karen Edison today. She is the Senior Medical Director of the Missouri Telehealth Network and Show Me Echo and the Center for Health Policy. She's a strong advocate for patient-centered healthcare and has cared for rural and underserved patients with skin diseases using teledermatology throughout Missouri from 1995 to 2019. So she's a pioneer, and she's been doing this type of thing. She's an expert. And today she is going to talk to us about tele-etiquette. And I'm excited to listen and learn more from Dr. Edison. So thank you so much for doing this, and it's all yours.
Thank you, Janine. I'm trying to pull up my talk here. And when I pull up my talk, I lose my share screen. So, well, I tell you what, I'm having trouble sharing my screen for some reason.
Karen, if you want to, do you see the green share button on the bottom of your screen?
No, not when I pull up my talk.
So keep your talk in the background, and then what you'll do is share your screen, and then you can pull up your PowerPoint.
Okay.
Or if you want to send it to me real fast, then I can pull it up while you're talking about it.
Yeah, let's do that because I'm on my Surface and it's not working very well. Thank you, Lauren. I appreciate it. Well, like I said last week, I would like to be a sort of a resource for you guys. If there's anybody here who is new at doing telehealth, or your people in your organization are new at doing telehealth and have questions about how to do it, it's pretty intuitive. It's pretty self-explanatory in general, but there are a few little nuances that are important to consider. I'm going to briefly talk a little bit about the technology, a little bit about communication tips, a little bit about what to do on your end, and then what to do after the visit's over. So about the technology, Lauren, did you get that?
Yep, I'm pulling it up now.
Great, thank you.
You're welcome. Let's see what if I can find my mouse.
So basically, I've been doing, as Janine said, teledermatology all over Missouri. I started doing that in about 1995, and I realized quickly that I could do most of what I needed to do for patients at a distance. Sometimes people would say, well, how do you create a doctor-patient relationship? I mean, how can you really have this therapeutic relationship at a distance? And I always tell the story about one of my patients from a very remote area of Missouri who had an immunobullous disease called bullous pemphigoid, which is a blistering disease that happens to the elderly. And I took care of her for many years, and I gave her many medicines that had side effects and risks and was, interesting to manage. And at the end of her life, she made an appointment with me. And those of you who are clinicians know that this happens when you have long-term patients and they know they're going to die. A lot of people do have that knowledge ahead of time, they will make an appointment with you and come into your clinic to say goodbye. And I'd had this happen to me maybe a dozen times in my career. And that day she made an appointment and she came over to telehealth to tell me goodbye. And it just really reinforced for me the fact that you can make a therapeutic doctor-patient relationship over the video screen. So a few words today about telehealth etiquette. Okay, Lauren, just click through them. I said this already, what we're going to talk about. Yep, next one. So practice ahead of time. That's fine, stop. Practice ahead of time, do a trial run. Make sure that your patient has broadband access. You know, there's a lot of focus on this right now in the state of Missouri, and I'm sure in all states, because as we go into this pandemic and people need to telework and kids need to do school at home, I think lots of the states are recognizing that there are some areas of broadband access lack that really need attention. And so we're doing that now. Know who to call for technical questions and have the number ready if there are problems. Like I just had a technical problem, and but if you were by yourself and you didn't have a bunch of people listening to you, know who to pick up the phone to call. Okay. Know how to contact the patient if your video connection fails. In my career, I took care of patients about 26 years using telemedicine, and I'd say maybe a dozen, maybe 20 times in all that time did I actually have to take care of the patient over the phone. So something happened where the video conferencing failed, and so we just finished up with a phone call. So know how to get a hold of them if something fails and get that information right up front, okay? What about your site, distant site considerations? And I put distant site in there for those of you who may not know the lingo. This comes from the federal law, and basically in the telehealth regulations, the originating site is the site where the patient is, and the distant site is the site where the telemedicine provider is. So this is about you as the telemedicine provider. Try to wear neutral colors, nothing bright or fluorescent. Actually, patterns and stripes don't come across as well on the video screen. So, and then also make sure you're not wearing like loud jewelry and nothing distracting. Okay. Carefully consider your background. You can see today I have a blue background. That's considered sort of best practice for video conferencing, is to have this blue background. You really don't want to have anything too distracting, and keep in mind that people notice more on video. I've been reading about this. Why do Zoom meetings feel so exhausting for us all? And it's because when you have these screens and these people really notice each other more than they would if we were just sitting around a conference table. So keep the background, really non-distracting, and standardize it if possible, so that you don't have to worry about your child or your husband or your wife walking through the screen, or, just try to standardize it if possible, okay? Look at and back to that standardizing it. What I did this morning is I went into our exercise room and took a picture of the painting on the wall. This is the blue I got, and I sent it to myself on email, and I saved it on my desktop. And then if you have, not everybody can do this, but if you can try down on Zoom by the little icon in the lower left that says stop video, there's a little up caret there. And if you click on that, you can choose your virtual background, and it gives you the option to choose it from a photo. So that's how I got that background, in case you're wondering. So look at the camera, not at yourself on the screen or your patient on the screen. Know where the camera is. If you have a camera that's above, you really need to look up into the camera when you're talking to the patient. It feels a little awkward, but you can see if I'm looking at the camera, I look like I'm looking into your eyes. And if I'm looking at my slides, you can see I'm looking down. So when you're talking to a patient and you want to engender their trust and communicate effectively, look into your camera. So you have to know where it is if it's not obvious, okay? Cover the windows and shut the door. It's best if your light is coming in front of you, not behind you or above you, causing a lot of shadows. So try to get the light in front of you if you can, and try to get a blue background if you can, and shut the door. Okay. I just talked about that. Have your head and shoulders fill the screen. Don't be way back in the room. Just try to do it this way. Okay. And then minimize background noises. Make sure you silence your phone. Make sure you're not tapping on your computer while you're doing your visit. The camera, the microphones are very sensitive, and it'll pick that right up. When I first started, when I teach people to first start doing telemedicine throughout my career, one of the things I've always noticed is that people think they can whisper and nobody can hear you because people are at a distance, but you can't whisper, right? Because the microphones will pick that up. So if you're not going to say something, if you wouldn't say something in a room with a patient in person, don't say something in that room if the patient's on the virtual screen. Okay, let's go to the next slide. Communication tips, make sure you introduce yourself. You might want to wear your name tag just to signify the officialness of your position. Say where you're from, who you are, okay? Let the patient know you're in a room alone. You know, patient visits sometimes are very personal. There's a lot of exchange of protected health information. You want to let the patient know that you're in a room alone and that nobody else is in that room with you. And sometimes you'll just see the patient just relax when you say that. You know, it's just me here. I'm in a room alone. Nobody else is on this call. This is a very secure call, and their shoulders will just relax a little bit. So, okay. Speak slowly and clearly and at a normal volume. That's the other thing people do when you first start teaching them to do telemedicine, is people want to yell or talk very loudly, and you really don't have to. Just talk at your normal volume. Go ahead. Be careful with your mute button. Don't trust it completely. So if there's something you wouldn't say, you shouldn't say in front of the patient, like I said, go out of the room if you have to say something to somebody. Don't just trust your mute button. People get in trouble with their mute buttons. So, okay. Limit gestures and distractions. Like I said, keyboard clicks, rustling papers, things like that. Try to keep the lines of communication open. Next one. This is important. In video conferencing, the patterns of our speech are slightly different. Even though it's so much better than it was 20 years ago, there's still a teeny weeny little lag that I think you'll notice. So when we talk to each other in our normal lives, we talk over each other all the time. You don't think you do, but if you really record people and listen to them, people talk over each other. What I mean by that is someone will start talking before someone else finishes talking. You can't really do that in video conferencing. It doesn't work that way because there's a little bit of a lag. So try and let the patient finish. Try to let them finish before you talk over them. Okay. After the visit, make a clear plan for follow-up. Know if you're going to have it. Just, any question you have, we've said this before about doing telemedicine, any question you have, the answer is almost always just like it is in person. So those are the two big things to remember. It's all just like it is in person. You're just using technology to bridge a distance. And the second thing is the same standard of care applies. So if you need to ask a follow-up question, ask it. If you need to have a follow-up visit, schedule it. Nothing is different just because you're using technology to deliver healthcare. If you can't do what you need to do using the technology, say so right up front. So just keep in mind and have your providers keep in mind that the same standard of care applies. So if they don't think they can do it safely and in a high quality way, then maybe they shouldn't be doing that. Okay. Document as per usual. in your EHR. Ugh. And then last one, communicate with the patient's primary care team, provider, if appropriate, if that's the arrangement you have, if the patient wants you to, but know who those people are. And also it's helpful to know when you're doing telehealth, what the infrastructure is around the patient, where they are, what are the resources, who their care providers are, what they have access to in terms of labs and pharmacy and radiology. It's really good to know something about the culture and resources that surround the patient where they are during the televisit. Okay. And I'm going to stop there and take questions. That is my email address. And like I said, I'm very happy to be a resource for you just on the nuances of telehealth. I think telehealth is just wonderful. I think that more and more providers after this pandemic will be open to using it than ever did before. You know, before the pandemic, most healthcare providers did not use telehealth, right? After the pandemic, most healthcare providers will have been asked to use telehealth or wanted to have been forced to or wanted to use telehealth. And I think after the pandemic, I think more and more people, I think more and more healthcare providers are going to think, wow, you know, I really could do a lot of the things I needed to do for my patients using technology. And wow, I could do some of that from home and maybe even at my convenience. And the patients are going to think, wow, boy, that was nice to get my healthcare needs met in my home, maybe at my convenience. And so I think in the future, there's going to be a lot more telehealth provided. And those of us who've done it a long time really want to be a resource for people to help them learn the lessons that we've learned and not have to make mistakes that we made along the way. So I'll stop there and take questions.
Thank you. That was excellent. A great reminder for many of us who are on Zoom calls all the time. So thank you for that. We're experiencing a little Zoom fatigue is what I understand. And so it's a great reminder, especially when we're with patients. So I failed to mention that you can always ask questions in the chat box. If you go pull down and find Ask Joe Kingsbury, you can ask questions in the chat there. But if you would just like to ask a question, just raise your hand and we'll get started with answering those questions. So I'm looking, anybody have a question?
Janine, we just got one in the chat. What is your opinion of best home EHR?
Is that to me? Is that my question?
It's not
Best home
specifically.
Best home EHR. I'm not sure exactly what that means. Most of the EHRs are from health systems, and I run a business from my home and typically only see inpatients. I run a business from my home. Okay. I would talk to the health system where you typically see those inpatients and see if they can hook you up with their EHR, if it works that way. We also, I don't know where you are in St. Francis. Is that St. Francis in Cape Girardeau? Is this in Missouri? In Missouri, we have some Zoom licenses that we're getting out to folks, primary care providers in rural health clinics and community health centers, federally qualified health centers and places like that. No, he's in Oklahoma, or she's in Oklahoma, independent. That's tricky. I don't know. I mean, I would, I'm not familiar with a home EHR, but you do need, if you see patients, you do need to document it. The federal government has loosened up the rules around telehealth quite a bit, but some of the things have not changed. And those are, HIPAA still applies and we still have to document what we do. They're letting us bill for more kinds of telehealth, but we still have to document what we do.
This is Rachel, and I can see that you say since you're an independent, there's no way to hook onto other hospitals' EHRs. What I would see typically in different types of telemedicine consultants is that they do end up contracting with the location where they're going to see patients. Therefore, they are authorized to get a login account for that electronic health record and log directly into that system to manage the documentation side of this. And that's what we see particularly in telepsychiatry practices. So most of them, if you say, what technology do you use? They say, we use whatever they have where I'm going to see the patients. So they just manage to, and I can probably find out more information on that if you would like me to, but they manage just to figure out how to partner with that organization and get a login into their system.
Any other thoughts? It's a great question, and we'll definitely do a little research and see if there's any way. Tim Davis from Oklahoma might be able to provide some insight to you after he does a little research. So Tim, you might keep that in mind.
Well, thank you. I do know St. Francis uses Epic here in Oklahoma. So I do believe you should be able to, as Dr. Edison mentioned, kind of come in as a contract, not employee, but a contractor. And so you should have access to that. But I'll see if there's another option as well.
Great, thank you, Tim. Any other comments?
Janine, we do have another question in the chat.
Excellent.
The question comes from Terry Coble in St. Louis. Any suggestions on helping our patients without Zoom? The invitation, et cetera, is often cumbersome for older patients, and we've been challenged by patients that still only have flip phones.
That is a great question.
This is Rachel from the Missouri Telehealth Network. Terry, what I can tell you is that when I've been talking to people about this issue, I've kind of heard a couple things. One is that they've had to utilize the patient's adult children or other types of people, like a community healthcare worker that could go into the home and help with that technology if you really needed a video call. But I could see where even a voice call might be difficult to manage when you're dealing with an elderly patient. And I think that this is just Rachel's opinion, that we're going to see a lot more use of the types of healthcare workers that are going to go into people's homes, like the community healthcare workers, to help manage the care of that patient.
Thanks, Rachel. This is Evelyn. For our patients, it's been really helpful to have the person contacting them ahead of time, whether it's a telemed coordinator or it's one of our roomers. Just that ability for the patient to kind of test with someone ahead of the appointment and really just have someone kind of talk them through and convey that confidence has helped. And then with using the phone, with behavioral patients that can be effective, I know our providers are always kind of thinking what's gained and what's lost by not having a picture and keeping kind of within that scope. Am I able to do my best standard of care, just like Dr. Edison was describing?
Next question in the queue. Could you please talk about the different telehealth platforms, pros and cons of Zoom versus SiteCall or other options? Are all MU providers using Zoom, and is it secure?
Great question. And next week, we're going to be talking more about technology and doing a demonstration about that, but I still think that it's important to answer this question today. So MU folks.
Karen, do you want to get started on that?
Oh, sure. Okay. Yes, at MU, providers are using Zoom, but it's the version of Zoom that is for healthcare, that is secure. We just, I think we went with Zoom because it's, even though it's difficult for some elderly people to sign in, it's comparatively what they call frictionless in the technology world. So it's a little more intuitive, even though I couldn't figure out how to share my screen this morning. It's generally a little more intuitive for people, and so we were able to rapidly. And the other thing is with Zoom, when you send an email to your patient, it's a randomly generated URL for one-time use, and so they just click on that link and they're with their healthcare provider. And I think there's some ways in Zoom to make it less cumbersome at the beginning. Rachel, do you want to talk about that?
We would be happy to do like a Zoom training. If people are interested, you can just let us know and we can set that up and people can come and we can do that. I think there are pros and cons of Zoom versus some other technologies, and that's really what we're going to get into next week when we have the technology experts on the call. And yeah, that's kind of all I have on that.
Thank you. And who would have thought that Zoom was going to be a household name? You know, everybody's Zooming now, and you've heard of Zoom bombing, and that's usually due to the fact that they are not in a secure chat room. They do suggest that if you're nervous about that and you're using Zoom, that you create a passcode to get into a meeting. But as far as the healthcare side, they take care of that. So, and there are still questions and that type of concerns about secure and encryption in Zoom, as well as in all platforms. I think this whole telehealth being implemented in days has, you know, many concerned about that. And so I think it's really important to understand that when you do have a platform, that you should have a BAA, which is a business associate agreement with the Zoom or with the platform that you have. That business associate agreement allows you to put that in your file, and if you're ever audited, then HIPAA can, you know, they can look at that and know that you're doing your very best at providing a secure and encrypted platform for your patients. So, so be careful about some of these platforms that don't offer that, because then you're not going to be protected on that. However, now in Medicare, and I think we may have talked about this last week during the policy and regulations, is that they're allowing people to use Skype or FaceTime, the types of platforms that people at home or that's not used to, you know, having these kinds of meetings, that they can use and for healthcare. However, like in the state of Kansas, there's many states that say no, you have to have a secure and encrypted platform. So Kansas was one of those states, and I'm not sure if Missouri and Oklahoma have that caveat as well in their policies. So we just have to be mindful of that.
Janine, this is Robert. I would say that Missouri and Oklahoma haven't really specifically stated whether that's allowed or not. So if ever possible, it's always better to use a HIPAA compliant platform.
Totally agree, because as we move forward, as Dr. Edison was talking about in her presentation, as we move forward and more people are using Zoom, you might as well get used to using whatever it is that you think you're going to use from here on out, because and it also just gives you a little better confidence, as well as the patient's confidence in you. So very good. Thank you, Robert.
Janine, this is Evelyn. I think, of course, the HIPAA secure technologies, but what Dr. Edison mentioned about knowing who's in the room and having that idea of who's in the environment with both the providers and the patients is another good thing to keep in mind as we're striving for HIPAA secure environments.
Very good. All right, Ask Joe Kingsbury, do we have any other questions?
There is another one sitting here in the chat queue. Are there any recommendations on equipment, specifically cameras and microphones, to add to existing computers in patient rooms that don't currently have those functions?
Great question. We will definitely address that next week, and even hold some demonstrations about different camera views and that type of thing. You know, I have no dog in the fight in terms of recommending any kind of webcam that you would retrofit, but I do know that our technology people at the University of Kansas usually buy the Logitech cameras that they just mount on top of a monitor or a if your laptop doesn't have a camera. Usually all laptops do. But as far as the monitors, some of the newer ones have cameras in them. But if you need to retrofit, we have used Logitech and have been pretty happy with that. So if you just Google that, and I think that's, you know, hopefully Amazon could deliver that. Any other suggestions? Anybody else use a camera that they really like? Silence. All right. And the Logitech camera, I'll also mention, also has a mic in it. So you can get the 2-for-1 there. And they work swell. Okay. Any other questions? Seeing no hands raised, seeing no questions in the queue. If you think of something, you know, type it in and we will answer before we sign off. But Robert, I wanted to give you the opportunity to talk about a funding stream that is currently open, and time is of the essence that we need to get this written if you're interested in it. So Robert, I'll give the Zoom to you.
I appreciate that. Thank you, Janine. I just wanted to really briefly, we didn't talk about this last week, and this program has opened up April 13th, and it's pretty important to get things in a timely manner. There's a couple actual funding opportunities. The first is out of the CARES Act, the Federal Communications Commission funding for what's called the COVID-19 Telehealth program. And it was announced on April 2nd. Obviously, it was in the CARES Act. There's $200 million in funding through the CARES Act. It's supposed to help healthcare providers provide connected care services to patients at their homes or in mobile locations in response to COVID. And it's immediate. The money's going out the door now. In fact, they made the first 6 awards, announced those on April 16th. And the money's going to last until the program funds have been expended or the end of the pandemic. So this is specifically related to COVID-19. It's limited to nonprofit and public eligible healthcare entities. And so there's basically 3 steps to apply. They began accepting applications on Monday, April 13th. There's a limit of $1 million for each individual applicant. So I would say that, you know, if you're a very small system, you're likely, you know, it's welcome to go in for less money, but there's also going to be some pretty large applicants. And if you're a healthcare provider that's already under the USAC program with the rural health funding that pay for broadband and other services, then you already qualify, or you'll have to go through the process of qualifying through USAC. And we'll send out later today sort of a 1-pager that talks about this funding opportunity with the links to the application and the requirements for this. So it does require medical services, patient-based internet-connected remote monitoring, other monitoring, video consults, voice consults, imaging diagnostics, other diagnostics, remote treatment, other services, and then the conditions, whether it either needs to be COVID-19 patients directly, but those without symptoms or conditions such as other infectious diseases, emergency urgent care, routine non-urgent care, mental health services that are non-emergency, and other conditions, you can use these resources for that. And then you really need to describe COVID-19. It has to be central to that. And really the priority is going to be given to areas that are impacted, and that'll be essential that you describe in your application. So what you can pay for is telecommunication services and broadband connectivity, voice services, internet connectivity for healthcare providers or their patients, information services, so things like remote patient monitoring platforms and services, patient-reported outcome platforms, store and forward, such as asynchronous transfer of patient images and data, platform and services to provide synchronous video consultation, and then internet-connected devices and equipment such as tablets, smartphones, or connected devices to receive connected care services at home, such as broadband-enabled blood pressure monitors, pulse oximeters, or things like that, and then telemedicine, kiosks, and carts for healthcare provider sites. So it does take into account the conditions to be treated using the COVID-19 funding, the goals and objectives for the program, which is really related to COVID-19 and the current public health emergency that we're under. Timeline, they want this money out quickly, they want these services quickly, they want this program to be used quickly. And then the geographic area and population served, whether the geographic areas has pre-existing strain, such as large, underserved, or low income, as well as the strain from COVID-19. And really want you to focus on high-risk and vulnerable patients. So like I said, on April 16th, they announced $3.23 million in funding that was already awarded out of the $200 million available to 6 initial applicants. And this, they went to Grady Memorial Hospital in Atlanta, Georgia, which is a hospital system, Hudson River Healthcare, which is an FQHC in Peekskill, New York, Mount Sinai Health System in New York, New York, obviously a very large area, very impacted by COVID, Neighborhood Healthcare in Cleveland, Ohio, the Ochsner Clinic Foundation in New Orleans, Louisiana, which got $1 million. And I do think some of these sort of large consortiums, whether it's a rural health association or a hospital association, primary care association, that brings together maybe some of the smaller providers for the larger amount of money may be useful, and then UPMC Children's Hospital in Pittsburgh. So that's that, and we will definitely send out more information and make sure it's very aware, but wanted to bring this up today because it's very important to, you know, those are the first initial applicants that have already been funded. Obviously, you know, that happened very quickly. I imagine there are many, many other applications already in. So if this is something your health system or your organization is interested in, really something that you probably really need to begin investigating, because it is a little bit of a process. I used to, I had USAC funding for broadband, to pay for broadband services previously, and know that, you know, it's not the easiest application. There's a lot of information. They have tried to make it very simple. Obviously, their turnaround time is very, very fast. So I wanted to make sure everybody was aware of that. The second thing that really wanted to talk about was that the USDA, for their distance learning and telemedicine grant program, they have announced a second round of applications that opened on April 14th, and they'll be open until July 13th. And they received an additional $25 million in funding under the CARES Act. And so I want to make sure that everyone was aware of that extended application period, because that grant program was already closed, but they've basically reopened it and are allowing a second application window. So like I said, we'll send out a brief one-page overview of these two programs today and any other funding opportunities that become available as the CARES Act gets rolled out with that additional funding, especially that focus on telehealth. And in a couple weeks, we'll be talking about the CARES Act and some of the other changes that are involved. Janine, I want to thank you for that opportunity, and hopefully anybody has any questions, also happy to take those. Please contact the Heartland Telehealth Resource Center, and we will make sure to get you all the information you need.
Excellent. Thank you, Robert. Good information. If we're looking, as health systems are looking for money, now's the time. It is the grant writing season usually, and these are the ones that definitely have something to do with telehealth. So thank you for that. Any questions come to mind? All right. Not seeing any hands raised.
Janine?
Yes.
Not everybody, I don't think everybody always looks at chat. So Joe, you want to read the chats for people?
Absolutely. There have been a lot of recommendations coming through as far as recommended equipment to use. It looks like both at Missouri Telehealth Network as well as OSU Telehealth, we're using the Logitech C900 series cameras for the laptops that come with the mics as well built into the camera. And I can speak from experience that working with my staff and utilizing the microphones that are built into the cameras as opposed to built into the computer device itself, the camera function and the clarity of the audio is far superior on those Logitech cameras as opposed to the microphones that are built into the laptops and computers themselves. So I'd certainly recommend if your staff or your organization decides to acquire some of these pieces of equipment, make sure that you learn about the functions of the integrated microphones because they are quite useful. There's also a recommendation from our IT staff at Missouri Telehealth Network using the Logitech PTZ or Pan Tilt Zoom Pro 2 camera. We use these cameras in our conference rooms as well as in the remote spaces where we host some of our Echo Hub teams for the Show Me Echo program. So those are great. Those are great resources for in-room use. Lauren?
I've been chatting with Michael over here offline, and he said he'll put together a document and send it to me so I can put that in the resource folder on Box.
Perfect.
Excellent. All right. Looks like we have another question in the chat.
We do. Sanjay, and I'm not sure which state Sanjay's from, but Sanjay says, try getting these webcams, but all Logitech webcams are sold out. Any success from anyone else's company? And Sanjay comes to us from St. Louis today.
Okay. You know, if you can't get them on Amazon and that type of thing, I'm not sure if maybe Best Buy would be another place that you can obtain computer equipment. I have seen them at Best Buy on occasion, but I doubt that they are a essential store right now. Maybe they are, I don't know, but maybe that you can order those online as well. Yeah, I'm sure there's been a scramble for this kind of equipment. So also, if you are part of the health system, you might check with your health system and see if the IT department has some of those squirreled away somewhere. And another question, do private independent physicians have access to any of these grants not part of the system and losing significant money?
So this is Robert again. So the description is that it has to be a nonprofit or a publicly eligible healthcare provider. So unfortunately, a private physician group would not be eligible for these funding opportunities.
Great, thank you for that clarification, Robert. All right, any other questions?
Janine, I would just say that this is best practice. Zoom meeting etiquette is to finish at 10 till because research is starting to show that Zoom meetings are more exhausting because our attention is so focused. And so if we always end a little bit early, it gives people a little break before their next Zoom meeting.
Boy, isn't that the truth? That's great new etiquette that I think is highly important. So, well, with that, we will thank you for attending this Zoom, and please tune in next week as we will have our friends from the Technology Assessment Center that will talk to us about technology. And be nice to Jordan when he comes on because he is from Alaska. So he's gonna have to get up really early and provide us some of this information. So, hey, thank you for joining us. I thought it was a robust conversation today, and please bring case studies if you have questions, concerns about implementation, and we'll do that as a case study. So we're going to give you that 10 minutes to relax before your next meeting. So thank you for joining our Echo today.